Dr. Andrea McSwain. Happy Thursday. Summer solstice starts today, first day of summer. That's exciting, and lots of good energy out there. And I want to talk to you about, first, the Michigan Center for Functional Medicine is a place where we reduce or reverse chronic disease. So that's very exciting. And then today I want to talk to you about beauty from the inside out. I'm really still talking about skin and how powerful skin is as an organ. We know, we've been told for a long time, it's the largest organ of our body. And so that's really important because it's the organ that we see so most readily. When I was in high school, I remember in my science class, there was a poster up that showed a woman who was coated in this like thick, gray, blotchy substance. And the tagline on the poster said, if you knew what your lungs looked like when you smoke, so it was really saying like, that lung congestion and all that accumulation of toxins in the lungs, if we actually saw that on our skin, she basically looked like she had carbuncles everywhere, then we wouldn't smoke, like we wouldn't expose ourselves to that toxin. A lot of people do have skin conditions. So when we look at a skin condition, a lot of people think about that as just a cosmetic necessity to improve. So things like blotchy skin or red skin or really dry skin or flaky skin. I can put Vaseline on that. I'm like, that's a petroleum byproduct. That's basically like gasoline. It's not really enhancing our nutritional needs of our skin. So we do have this, the skin, and we have an expression of what's going on the inside, on the outside. So beauty from the inside out. So how do we help our skin so that our internal organs actually get better? And so there is a relationship between the health of the liver and the lung. Some people develop little tiny red spots, which are often called petechiae, and those are little tiny red dots. They can be raised, and that is a reflection of liver health, but we see it on the skin. Other people develop cold sores. That's a reflection of the immune system being suppressed and stressed, and a chronic virus coming out and manifesting sometimes on the lips or the mucosal area, and sometimes as well inside the mouth, which is very painful. So the other connection can be, like I said, the lungs with the skin. I also talked about the liver with the skin, and then the gut with the skin. So we can see eczema in a lot of people, or psoriasis, which is large patches of red and flaky. It's really inflamed, and that's actually a reflection of what's going on with the inflammation in the gastrointestinal system. So when we see someone, from a functional medicine perspective, when we see someone with a skin condition, it's not just surface level, right? We have to think about what's going on deeper. And that's really the essential part of seeing someone as a whole unit, right? So seeing someone with a rash and saying, do you have asthma conditions, or looking at their multi-symptom questionnaire and saying, I see that, we are concerned about skin conditions, but we're also looking at some respiratory conditions, and start looking at a person as a whole unit, and more than just this symptom here, this symptom there. So that's really important. And if you want to PM me and get a multi-symptom questionnaire, or go onto our, just PM me. That's probably the best way for right now. And then, so your skin does represent the internal organs, but then your skin also shows how your body is processing or using the nutrients. So some conditions like psoriasis or eczema can indicate a gluten problem, or that gluten inflammation, where people are getting all that extra gluten because the wheat is genetically modified to make it stronger, but that is too much gluten for our body. We're not used to having wheat with that level of gluten, and as a result, we develop an inflammation response that some people actually don't necessarily feel bad in their intestinal tract, but they notice a rash or redness area on their skin. So there's gluten sensitivity that can manifest as a skin condition. As I mentioned before, with cold sores. You know, cold sores, and I'm gonna just take us there for a minute, is a virus. It's part of the chickenpox family or herpes virus, and it is present in 80% of people. So it's there. It's a virus that's very common. It is. And then what happens, people are stressed, their body uses up a certain amino acid. And so it's actually called lysine. And then there is another amino acid called arginine. Arginine and lysine compete. And when the body is stressed out, it uses up the lysine. When it uses up the lysine, then the virus can come out. So it's actually nutrition deficiency that can be reduced. It can be, you can reduce the cold sore intensity, frequency, duration by knowing that it is a nutrition deficiency. And that's actually been known for a really long time. I can get into that later on a different occasion, and you're also welcome to PM me if you have any specific questions about that. Because I do have a protocol to help reduce frequency of cold sores and severity of cold sores. We also have some really great ways to do that, so that's a good thing. Then, you know, looking at protein integrity. So there is, the skin can really show, you know, protein deficiency. So if there is skin that's sagging or loses its turgor, the skin that's sagging can often be a protein deficiency or not enough protein. And then the skin that loses its turgor, or the integrity between the skin layer and the deeper layer, that kind of fat layer, that can be improved actually with application of coconut oil, unrefined organic coconut oil. So those are starting to tell you a little bit about the next part, which is everyday food supports to help your skin. And when you help your skin, you're helping your organs from the inside out. So some things that our skin really loves and that helps our body is, first of all, looking at gluten. Hi, Melissa. Hi, Dave. You really want to look at gluten and look at other food sensitivities like eggs, peanuts, soy, corn. So really looking at those. And then also some other things that the skin really likes, apple cider vinegar. So apple cider vinegar is a great way to just help your skin overall feel healthier. It also helps with your hair. It makes it shinier, and it makes the hair follicles tighten and not fray. So that's a really great thing for your body, and also it's very nourishing overall. And then rose hips. So rose hip tea, which you can find in Yogi Tea Skin Detox. Now I caution you, because there is, rose hips is very good for cleaning out your liver, but it can overwhelm your system. So you want to use it slow at first, you know. I would recommend you just think about, you know, if you're using a lot of alcohol, that, you know, you might start once a week with the skin detox, and then kind of see how your body handles losing those toxins, because you don't want to overwhelm the system when you are detoxing. But rose hips is a nice place to start to get that liver cleaned out and to get that glow in your skin. And then I talked about coconut oil, which is great. And then we will talk some more in the future about some other things. So yay, apple cider vinegar. That's right, Dave. We are big fans of that. So also, if you have any questions, or if there's a topic that you'd like to listen to, we have a lot of programs and services coming up that I'll be talking more about. And thank you so much for tuning in. Have a wonderful Thursday. Please share this with others. Just know that we can heal. We can heal ourselves, we can help heal others, and we can help heal the world. Many blessings. So thank you so much, and have a wonderful night.